Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
Thanks so much for having us. My name is Arna. I'm the CEO here at Waveley Diagnostics. The problem that we're solving is how hard it is to do virtual care for kids. Kids have a really hard time expressing their symptoms. I have two little girls. They could be in the backyard with a broken leg. They'll tell me they have a tummy ache. It's always a tummy ache. And so what that means is that pediatrics is highly reliant on schlepping into the doctor for physical exams and diagnostics. And so what we're doing is we're building a platform of smartphone diagnostics that give you very focused physical exam findings for the main reasons kids go to the doctor. So that instead of schlepping into the clinic with our diagnostic app, the doctor can then do a virtual visit and get the physical exam finding from the software that we provide. This is software, this is not hardware. So we've done an analysis of CDC data, and we believe that 69% of acute pediatric visits could actually shift into the virtual space with the right physical exam finding via an app in the parent's hand. Earlier this year, we launched the first app in our platform, which addresses the #1 driver of pediatric visits, which is ear infections. It's 30 million visits a year, and with our app, these can be diagnosed over a virtual visit. Our app detects middle ear fluid, and we do that by holding the phone up to the ear, playing sound in the ear, and picking up the reflection of that sound from the tympanic membrane. Now, what's really exciting is now that we've launched, we actually have early data from the field. And what we're finding is that antibiotic stewardship is significantly improved when using our app. So we did an analysis of all the visits that occurred with one of our customers, and only 26.5% of those visits resulted in an antibiotic prescription, whereas 34% of visits resulted in antibiotics prescription nationally. And so that's a great selling point for physicians. They're really excited about it. This is a great convenience factor for parents, a great peace of mind factor for parents. And we figured out how to make the economics work. So happy to be here today.
Great, thanks, Arna. I've been following you guys for a while. Is there any insight you're getting now briefly that when you look in for fluid in the ear, you can start to differentiate viral versus bacterial?
So our medical advisory board, led by our chief medical officer, has created a clinical algorithm based on AAP guidelines that essentially figures out through clinical factors and through the result that we provide of fluid, whether treatment by antibiotics is merited or not is a good idea. And so, while we are still providing a binary fluid or no fluid result, that doesn't immediately mean it's an ear infection that needs to be treated. The doctor has to look at other clinical factors as well that give clues into whether it is a bacterial infection that needs treatment.
As we know, again, I'm trained in pediatrics and internal medicine, but we've also seen a dearth of solutions in the pediatric space, or they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
Agree 100% about all the answers around the economic ROI. It's really hard to launch a product that doesn't help providers make more money, in essence, just given the dynamics of our system. But the direction that I would like to take the answer is a little bit different. I think there's a very unique dynamic in the pediatric space in that you're building a product that needs to involve children in how you use it. So you need to design the product so that children and parents can use it really effectively together. And that's a very different process and a very different approach than designing a product that parents use themselves or adults use themselves, right? Because you don't have the issues around compliance and, fear that children may have when it comes to some of the devices that are here today. And so what we've done, for example, is we've designed our app interaction so that parents can actually have kids involved and the kids can press the buttons. And what we've seen is that when kids get to, press the big button to start the test, when it's in their control, that completely changes the dynamics. And so that human-centered design to make the product work between kids and parents or providers and kids is absolutely critical to drive adoption of pediatric products.